Hello and welcome back. I'm Dr. Caleb Sterling, and if you've been watching my channel, you know that I work with seniors every single day who are dealing with high blood pressure. Now, one of the questions I get asked most frequently is this: what can I drink before bed to help lower my blood pressure? And I want to tell you, this is actually a really smart question to be asking, because what you consume in the evening, especially right before sleep, can have a profound impact on your cardiovascular health and your blood pressure numbers. Now, I know you've probably heard a lot of conflicting information out there. Some people say drink this, some people say avoid that. And honestly, it can get confusing. But today, I'm going to break this down for you based on what the science actually shows us. I'm going to walk you through the best drinks for lowering blood pressure before bed, explain why they work, and then I'm going to give you some practical tips for getting started tonight. Let me start with something really important. If you're currently taking blood pressure medication, please do not change anything without talking to your doctor first. What I'm sharing today is about lifestyle strategies that complement your medical treatment, not replace it. Think of these drinks as part of your overall heart health strategy, working alongside whatever treatment plan you already have in place. Alright, let's talk about blood pressure for just a moment. Your blood pressure naturally drops when you sleep. This is actually a healthy, normal process. We call this the dipping phase. But for many seniors, especially those with hypertension, that dip isn't happening the way it should. And that's a problem, because when your blood pressure stays elevated during sleep, your heart is working harder even when you're supposed to be resting. Over time, this puts tremendous strain on your cardiovascular system. Now here's what's interesting. What you drink in the 2 to 3 hours before bed can actually influence whether you get that healthy blood pressure dip or not. And that's where today's topic becomes really relevant, because there are specific beverages that can help facilitate that natural drop in blood pressure when you sleep. Let me start with the number one drink that I recommend to my senior patients, and that's water with a pinch of natural magnesium. Now, before you think I'm talking about some complicated supplement routine, hear me out. Magnesium is a mineral that your body needs for normal muscle function and nerve transmission, and it has a natural relaxing effect on your blood vessels. When your blood vessels are relaxed, they're less constricted, which means blood flows more easily, and your blood pressure naturally decreases. The beautiful thing about magnesium is that it also helps you sleep better, and better sleep means better blood pressure regulation. Now, you can get magnesium from food, which is what I prefer, but you can also add just a small amount to your water. I'm talking about a pinch, not a full supplement. You can get magnesium water at most grocery stores now, which is actually quite convenient. The reason I love this recommendation is because it addresses two problems at once. First, it helps lower your blood pressure. Second, it promotes better sleep quality. And when you sleep better, your entire cardiovascular system functions better. It's a 2-for-1 benefit that I see working in my own patients all the time. Now, let's talk about herbal teas, and specifically, I want to focus on hibiscus tea. Now, I know some of you might be thinking, hibiscus? That's just a pretty flower. But the research on hibiscus tea and blood pressure is actually quite compelling. Studies have shown that hibiscus tea can lower both systolic and diastolic blood pressure. It's believed to work because hibiscus contains compounds that help relax your blood vessel walls. Here's how I usually recommend it. Brew a cup of hibiscus tea about an hour before bed. Let it cool down so it's not too hot to drink. You want to give yourself time to process the liquid before you actually lie down, because you don't want to be waking up multiple times in the night to use the bathroom. Sip it slowly, maybe while you're reading or watching something relaxing. The act of slowing down and having that quiet time before bed is actually therapeutic in itself. It signals to your body that it's time to start preparing for sleep. Now, I want to be clear about something. The research shows the benefits of hibiscus tea, but it's not like drinking one cup is going to cure your blood pressure. We're talking about a gradual, cumulative effect. But over weeks and months of consistent use, my patients definitely notice a difference. Their blood pressure readings improve, they sleep better, and they feel more relaxed overall. Another tea I really like recommending is chamomile. Now, chamomile is famous for helping you sleep, but what people don't realize is that better sleep directly impacts blood pressure. When you have insomnia or poor sleep quality, your sympathetic nervous system stays activated. That's the fight or flight system. And when that system is constantly activated, your blood pressure stays elevated. Chamomile helps turn off that system and activate your parasympathetic nervous system instead. That's your rest and digest system. And when that's activated, your blood pressure naturally drops. I typically recommend chamomile tea for my patients who are dealing with both sleep issues and high blood pressure, and the combination of benefits is really remarkable. You're not just getting better sleep, you're actually retraining your nervous system to be calmer, which has lasting effects on your blood pressure throughout the day and night. Let me talk about something that might surprise you: beetroot juice. Now, this one is particularly relevant for seniors because beetroot juice contains nitrates, which your body converts into nitric oxide. Nitric oxide is a compound that helps relax your blood vessel walls and improve blood flow. It's actually so effective that some of my patients have seen measurable improvements in their blood pressure within just a few days of drinking beetroot juice. Now, here's my recommendation. You don't need a huge glass of beetroot juice. In fact, that would be too much. I usually recommend about 2 to 3 ounces mixed with water so it's more diluted. You want to drink this about 2 to 3 hours before bed, not right before sleep, because beetroot juice can have a diuretic effect and you don't want to be waking up multiple times in the night. One thing I should mention, beetroot juice is quite concentrated and quite sweet, so if you have diabetes or blood sugar management issues, you'll want to be more careful with this one, but for most of my senior patients, it's a great addition to their evening routine. Now I want to talk about low-sodium bone broth. Many of my senior patients love bone broth because it's good for joint health and gut health, but what many people don't realize is that bone broth also contains collagen and amino acids that support vascular health. Your blood vessels need collagen to maintain their elasticity. When your blood vessels are elastic and flexible, blood flows through them more easily, and your blood pressure is naturally lower. The key here is low sodium. You need to make sure you're getting bone broth that doesn't have added salt because salt raises blood pressure. But a warm cup of low-sodium bone broth before bed is soothing, it's comforting, and it actually supports your cardiovascular health. It's a drink that checks a lot of boxes. Let me talk about something that might seem controversial: wine. Now, some of you might have heard that a little bit of wine can be good for your heart, and there is some research suggesting that moderate alcohol consumption, particularly red wine, might have some cardiovascular benefits. But here's what I tell my senior patients. The word moderate is really important. We're talking about no more than 1 4-ounce glass for women, maybe a little bit more for men, and only if your doctor has okayed it. Red wine contains resveratrol, which is an antioxidant that can help with blood vessel function. But the relationship between alcohol and blood pressure is complex. For some people, even small amounts of alcohol can raise blood pressure, so this is definitely something to discuss with your doctor individually. But if you enjoy a small glass of red wine in the evening with dinner, not right before bed, it might actually be beneficial. Just make sure it's not something you're doing every single night, and make sure your blood pressure is monitored regularly. Now let me talk about what you should absolutely avoid, and this is really important. You want to avoid caffeine after about 2 o'clock in the afternoon. Caffeine is a stimulant. It keeps your sympathetic nervous system activated, and when that system is activated, your blood pressure stays elevated. Some studies suggest that caffeine can increase blood pressure by as much as 5 to 10 millimeters of mercury. For some seniors, that might not sound like much, but when you're dealing with hypertension, every single point matters. You also want to avoid high sugar drinks in the evening. Sugar causes inflammation in your blood vessels, and inflammation makes your blood pressure go up, so no sugary juices, no sodas, no high sugar smoothies before bed. This is really important. And finally, you want to avoid alcohol in large quantities, obviously. But you also want to avoid it right before bed. If you're going to have a drink with dinner, that's one thing. But drinking alcohol right before sleep disrupts your sleep architecture. It prevents you from getting the deep, restorative sleep that your body needs to regulate blood pressure properly. So here's what I typically recommend to my senior patients when it comes to beverages before bed. Start with a simple baseline. Make sure you're drinking enough water throughout the day. Dehydration can actually cause your blood pressure to go up. But then, in the evening, incorporate one of these beneficial drinks. My typical evening beverage protocol is this. About 3 hours before bed, drink an 8-ounce glass of water, maybe with that tiny pinch of magnesium. Then, about an hour or two before bed, have either a cup of hibiscus tea or chamomile tea. Sip it slowly. Make it a ritual. This signals to your body that it's time to start winding down. If you like bone broth, you can have a warm cup instead of the tea. Now, consistency is absolutely key here. You're not going to see dramatic changes overnight. But if you implement these drinks regularly, and I'm talking about every evening, not just once or twice a week, you should start to notice that your evening blood pressure readings are lower. Some of my patients see improvements within 2 to 3 weeks, others take a bit longer. But the pattern I see is that these drinks work. Let me share a quick case study from my practice. I had a 72-year-old patient, let's call him Robert. Robert had high blood pressure and he was on medication, but his numbers were still not where they needed to be. He also had terrible insomnia. So I recommended that he start incorporating hibiscus tea in the evening, along with making sure he was well hydrated throughout the day. After 4 weeks of consistent use, his evening blood pressure readings had dropped by an average of about 12 millimeters of mercury, and his sleep quality improved dramatically. He was finally getting 6 to 7 hours of solid sleep instead of the 4 to 5 hours he was getting before. The combination of the tea and the better sleep created a positive feedback loop. Now here's something I want you to understand. These drinks are not magic. They're not going to replace your medication if you need it, but they are powerful lifestyle interventions that can support your medication and help you get better overall control of your blood pressure. And when you combine them with other healthy habits, like regular movement, stress management, and eating a heart-healthy diet, the effects are really remarkable. I also want to mention something about timing and routine. The reason I specifically recommend these drinks in the evening is not just about the compounds in them. It's also about creating a wind-down routine. Your nervous system responds to routine. When you consistently do the same thing every evening, brewing a cup of tea, having that quiet time, taking care of yourself, your body starts to anticipate it. Your parasympathetic nervous system begins to activate earlier and earlier. Over time, just the ritual itself starts to lower your blood pressure. So what I'm really recommending is not just the drinks, but a whole shift in how you approach your evening. It's about slowing down. It's about being intentional. It's about taking care of your cardiovascular health in a way that feels nurturing rather than restrictive. Let me give you some practical tips for getting started. Number 1, start with just one drink. Don't try to overhaul your entire evening routine at once. Pick one of these beverages that appeals to you most and start there. Maybe it's chamomile tea because you love tea, or hibiscus because you like trying new things, or water with magnesium because it's simple and straightforward. Number 2, get a nice cup. This might sound silly, but it actually matters. If you're going to be drinking this every evening, get a mug that you enjoy holding. Make it pleasurable. This is self-care, and self-care should feel good. Number 3, track your blood pressure. Take readings at the same time every evening, preferably before you have your drink. You want to establish a baseline, and then you can watch it improve over time. This gives you concrete evidence that what you're doing is working, and that motivation helps you stay consistent. Number 4, be patient. I know I've mentioned this, but it bears repeating. These changes take time. You're not going to feel a dramatic difference the first night, but over weeks and months, you will absolutely see improvements in your blood pressure readings. Number 5, talk to your doctor. If you're on blood pressure medication, you want to keep your doctor informed about any changes you're making to your routine, including new beverages. In some cases, as your blood pressure improves, your doctor might need to adjust your medication, and that's actually a great outcome. It means the interventions are working. Now, I want to circle back to something I mentioned at the beginning, the importance of that natural blood pressure dip that happens during sleep. This is called nocturnal dipping, and it's a sign of good cardiovascular health. If you're not a dipper, meaning your blood pressure doesn't drop when you sleep, that's actually a risk factor for heart disease and stroke. But the good news is that these interventions can help restore that normal dipping pattern. By improving your evening routine, by promoting better sleep, and by including these beneficial beverages, you're actually retraining your cardiovascular system to function the way it's supposed to. So here's what I want you to take away from today. Your evening beverage choices matter. They matter a lot. What you drink in the hours before bed directly impacts your blood pressure during sleep, which impacts your overall cardiovascular health. Beverages like hibiscus tea, chamomile tea, magnesium-infused water, bone broth, and beetroot juice all have evidence supporting their benefits for blood pressure management. Start with one, be consistent, give it time, and track your results. And remember, if you're a senior dealing with high blood pressure, you're not alone. Millions of people are facing the same challenge. But the great news is that there are so many evidence-based strategies you can implement right now to improve your situation. And many of them are as simple as changing what you drink before bed. I want to thank you for watching. If this information was helpful, please like this video and subscribe to the channel. If you have questions about your own blood pressure management, leave them in the comments below. And as always, if you're making any changes to your health routine, please discuss them with your doctor first. Your cardiovascular health is too important to leave to chance. So start tonight. Brew that cup of tea. Sip it slowly. Give your body the care it deserves. I'm Dr. Caleb Sterling, and I'll see you in the next video.